patient in room 1. Hello, come on in, take a seat. Welcome to the ASMR OBGYN clinic. My name is Lee and I am your front desk / medical assistant that will be gaining your history, doing your vital signs, sort of identifying what brought you in clinic today. How are you doing? Not too bad. And what has brought you to the ASMR OBGYN clinic? Okay. Yep, you're in the right place. Before I get started, I just need your first and last name. Is this your first time here? Okay. Yeah, I'll just need your first and last name then. Okay. And then what is your date of birth? Okay. Yep. I see that you've went to other clinics that use a similar EMR system. Any changes to the Blue Cross insurance plan? Okay. And it looks like we don't have an emergency contact on file for you in the event that there is an emergency. Do you mind providing me with one? Okay. So that's mom's name and number. Okay, got it. Perfect. And then in the event that we have to send you any medication for what you're coming in for, do you have a pharmacy that you would prefer it get sent to? Okay. Yeah, I'm familiar. For sure. Yeah. Okay. And then I just want to go over your medical chart real quick. For medical history, it just shows some allergies. Okay. And then medications right now, they have that you're not taking anything right now. Okay. And then do you smoke or drink at all? Any prior use? Okay. Any substance use? Marijuana? And how often? Okay. And then any family history that we should be aware of? And that's with father. Okay. Now, a little bit of a personal question, but are you sexually active or have you been in the past? Male, female partners, or both? Okay. And any prior history of birth control use or barrier methods like condoms? Okay. And do you know if you were ever vaccinated for Gardasil? Okay. Okay. Thank you. So we've got your chart built up here. I am just gonna have to take your blood pressure as well as your temperature, if that's okay. Awesome. Okay. Put these on. Yeah, it's pretty cold outside. You are not kidding. Once we get your vital signs, I will kind of go over the history of your current concern. Sounds good? Awesome. Alright. So, this is just going to go right around your arm, okay? You can sneak that in here. Perfect. Just going to tighten it a little bit here. I'm just going to get your blood pressure. If you could uncross your legs, just give me 1 second here. just save that into the system here. Remind me of your date of birth. Okay. Perfect. Blood pressure was completely normal. Let me take this off of you. Alrighty, just slide that out. There you go. Awesome, awesome. Step one done. Alright. Let me just put this back in place. You're not having any cold or flu-like symptoms, concerns with COVID. Let's get this temperature check going. Alright, just there. Right, gonna throw that out in a second. Alright, and if you wouldn't mind, this is just gonna go underneath your tongue. Okay, looks good. Temperature is within normal limits. Let me put both of those into the system here. That was sublingual. Okay. All right. Very good. Throw this out. Gloves in a second. So, talk to me a little bit more about kind of so I know it's discharge. Is it regarding current discharge that you have, a discharge education? Kind of what can we do for you? It would so help if I had a pen. Wouldn't you agree? Give me 1 second. I'm so sorry. Just enjoy the ruffling sounds, I suppose. Got the pen. So you've kind of had an on and off discharge? Okay, yeah, no, I completely understand. You just feel like over the past year it's been more. Just wanted it looked at. Okay, for sure. Have you had like a pelvic exam before? Maybe one other time at like an urgent care? And were you diagnosed with anything at that time? Yeast infection. Antibiotics are like the #1 culprit. I completely understand. No, yeah, like you're absolutely right. Generally, discharge can absolutely be normal, part of our normal physiology. Our job is to kind of be aware of signs that maybe it's not normal or an abnormal discharge, whether it comes with like an odor, an itch, a burn. So we can absolutely do a pelvic exam for you. Just to make sure everything looks normal and there's no erythema or redness, as we say, no signs of infection or inflammation. I could totally tell her to do that. That's no problem. Sometimes we just need that reassurance. I totally get you. And then, yeah, there are other vaginitis type conditions, whether it's BV or pH imbalance, yeast infections, and of course STI is what we can acquire with sexual contact, if not using protection, like gonorrhea, chlamydia, trichomonas, that sort of thing. Do you want to be swabbed and screened, like a full comprehensive swab, or can absolutely do that for you? Yeah. Now, just so you know, with getting vaginal swab collections of like the sexually transmitted infections, that doesn't include all of them, meaning some are acquired through blood work, which would be hepatitis, syphilis, and HIV. So I just wanted you to be aware that through the swab, you're only getting the gonorrhea, chlamydia, and trichomonas testing. Yes. Yep. So what you can expect then is Leanna, the PA, will come in. You could keep everything top-wise on. You'll be just getting undressed waist down. don't know if that was English, so sorry. And then she'll do an external exam of the vulva, do an internal exam with that speculum device. Of course, we'll use a smaller one. And then if we ever have to go longer for whatever reason, we'll let you know. Everyone's anatomy is different. And then we'll do the internal speculum exam, where we assess the inside of the vagina, we see your cervix, and then we could do the swab collections for you of any discharge that we may see. And then she could always end it with a manual gloved exam. You'll pass on that one. Absolutely. You are completely in control of this exam, so you just have to tell me what you're comfortable with. And if you're not having any pain, there's really no indication that she would have to anyway. But at the end of the day, we need your consent regardless. So you are okay with an external vulvar exam where she's just looking on the outside, and then the internal speculum exam where she's inserting the device, looking in the vagina, swabbing the discharge, but you do not want an internal gloved exam. Yes, and that gloved exam would just be to see if she feels any enlargements or masses. Yeah, no, that's totally fine. I will let her know. And so what I'm gonna have you do then is just get undressed from the waist down. Everything top-wise stays on. There will be a drape waiting on the table here for you. And then she will do your pelvic exam. Just make sure the discharge is normal. And then as you requested, we'll do the swab testing as well. Yeah, I could show you that. So the swab test, it's gonna be 2 of these. They're just like little Q-tip swabs. I'm sure she'll be able to show you, but yeah, exactly. All right, well, I'm gonna give you some privacy, and then Leanna, the PA, will be in. Absolutely. Hello. My name is Leanna, and I am the ASMR PA that'll be doing your pelvic exam today. Lee, the MA, was just telling me that you seem very knowledgeable regarding discharge, and of course there could be that normal discharge versus distinguishing that from an abnormal, and that you just want it to be safe, get swab testing for everything. Yep, I completely understand. And then we will be doing just an external vulvar exam with the internal speculum exam, but no manual exam with the glove. Does that sound about right? Okay, just making sure. Do you have absolutely any questions before we get started? All right. So let's get everything going. I'm gonna grab a pair of gloves. And of course, if at any point during this exam you are incredibly uncomfortable or something is concerning to you, please just let me know. For sure. All right, so what I'm gonna do here is I'm just gonna take the stirrup symbol. And if you wouldn't mind just scooting your bottom all the way to the edge. Okay. You are good where you are. I'm just gonna take the light, I'm gonna shine that, and then you are just gonna feel my gloves on the outside. Just doing that external exam. You're not noticing any itching, burning. Okay, good. Yep, skin looks healthy. There's no abnormal moles or lesions. You feel like sometimes you get ingrown. Yeah, definitely can happen with shaving, absolutely. All right, next step is going to be that speculum exam. So I'm gonna put some lubricant on there for you, and then we're gonna do the swab collections. So let me just open up the swabs. Okay, got swab number 1. And swab number 2 are opened. lubricant. This is just going to feel like a lot of cold pressure. You've had a pelvic exam before, right? All right, you just communicate with me if you're too uncomfortable. I'm going to insert here. All right. Yep, cervix looks healthy. Let's collect those swab samples. Swab one. Yeah, the discharge I'm seeing is very clear, a little bit kind of, yep, that stretchy consistency, but looks completely normal. I'm definitely not concerned. Yes. Second swab. Yeah, you'll want to look out for like a different color from what you're used to, like perhaps a yellow, a gray, a green, burning, itching, a fishy odor, like a stronger odor. Exactly, yeah. And then if, just collecting that last one. Okay. Let me take this out for you. And if you are sexually active, it's always good to get routine STI swabs and screening because most people actually present with no symptoms when they're diagnosed with gonorrhea or chlamydia. Yeah, I feel like a lot of people don't know that fact. Absolutely right. Okay, I'm just gonna cover you up here. We'll take these gloves off. Both swabs were collected. And so we're gonna send those out to the lab for you, okay? Yeah, I suspect everything will come back normal, but always good to be on the safe side. With that being said, you do definitely have a good general understanding of the discharge. I think it's great that you know that, of course, a lot of discharge can be normal. Sometimes discharge can even give us like clues as to what time of the cycle that we're on. Ovulation's kind of more like that stretchy yolk-like discharge. So you have been doing great with your research. If you ever need to come back in for routine screening, if you ever feel like something is off, definitely let me know. But as far as today's examination, I'm writing it as a normal pelvic exam. And then those swabs will screen for the pH imbalance, yeast infection, gonorrhea, chlamydia, and trichomonas. Absolutely, yeah. Do you have any questions at all? Yeah, that manual exam that you deferred with the glove is typically what we do for people who may have some pelvic pain, or we just want to rule out, you know, any enlargements that are noted at the uterus and ovaries, since those are two organs that we cannot see in an internal pelvic. Yeah, no, that's completely okay. Whenever you're comfortable with getting it done, or whenever you feel like you have to get it done, you just come right back into the ASMR clinic, okay? Absolutely. No, for sure. And then we will be in touch if it shows anything. Yep, yeah. I'll give you your privacy and then we'll see you at checkout. You're so very welcome.